All right, students, in this section, I wanted to talk about white blood cells and platelets. Again, a part of the very important components of our blood system. Again, so we have red blood cells, white blood cells, and platelets. I'll talk about red blood cells a little bit later, but right now I'm going to talk about white blood cells and platelets, or in other words, leukocytes and thrombocytes. All right, in terms of white blood cells, we abbreviate them as WBCs, leukocytes. They're like the defenders of our body, if you will. I just grabbed this picture of some jet fighters and some soldiers, simply to represent that it's a part of the defense mechanism and strategy of our body to protect our body from things that go awry, to protect our bodies from things that are not supposed to be inside of our body. And actually, our white blood cell system, or our defense mechanism, actually does defend our body to try to destroy cancer cells as well. Our body naturally produces cancer cells, and white blood cells help to identify, locate, and destroy cancer cells that naturally produce in our bodies daily. Okay, so these are again the white blood cells. So these are different kinds of white blood cells, and this is just only actually showing just, I guess, some different kinds. I can get even more specific. There's things called like CD8 cells, CD8 positive cells, CD4 cells, CD4 positive cells, or T lymphocytes there, but that's kind of going a little bit beyond that, which I want to deal with. But you have like what's known as the basophils, neutrophils, eosinophils, monocytes that can manifest themselves or differentiate into macrophages, and the lymphocytes. All right, so these are the granulated cells. They have granules, and basically these are non-granulated cells. The lymphocytes can manifest themselves, or actually examples of lymphocytes would be the B cells and the T cells. And this macrophage is a phagocyte. So he just gobbles things up. So things that are not supposed to be in our body, just gobbles it up. Simply like Pac-Man. So all of these white blood cells, just like in the military, in terms of for combat infantry units, they all have their own designated roles. And same thing with the white blood cells, or the leukocytes. Okay, this is just a picture of cells, as you can see here. And these are neutrophils, white blood cells, and these are red blood cells. And of course they're red, and they use simply dyes for that. You might notice that, okay, well, this looks kind of empty and hollow. Well, it's not actually empty and hollow. It's just kind of curved in because red blood cells are anucleated. They do not have a nucleus, whereas clearly you can see a nucleus in this neutrophil. All right, and a lot of times we think that nucleus are supposed the nucleus is supposed to be, like nice, a circle and many cells. No, it can morph. It can change shapes, configurations, particularly with these neutrophils, as you can see, and of course these are platelets. Now that, which is interesting, it's about 700. So there's about under somewhat normal conditions, 700 red blood cells or erythrocytes to 1 leukocyte. So in other words, 700 red blood cells to 1 white blood cell. And if you were to do a count right here, you're like, hey, this does not look like a 700 to 1 ratio. Well, that's because they actually, when they took this picture, they actually, moved the slide to see where that they can actually photograph 2 white blood cells in the midst of the red blood cells. But again, red blood cells hugely outnumber white blood cells. So that's why when a person bleeds, okay, you see red, not white. Are there white blood cells that are actually white in color if you were to spin it down or separate the blood in a test tube? Yes, but it's just so many red blood cells than white blood cells. All right, so this is a phagocyte. and that is actually extending what we call these are called pseudopods, extending pseudopods, and is grabbing bacteria organisms, bacteria cells. We call this bacilli. There's more than one bacilli, but it's just one is bacillus. But nonetheless, grabbing bacteria cells that should not be there and just going to pull them in and engulf them. All right, so here's another example. Here's a phagocyte, acts like Pac-Man, gobbles up bacteria, engulfs them, and actually right now it's inside, in which this structure we call a phage or lysosome, and it's going to release digestive enzymes, adjust the pH, and get some proteins and enzymes there that's going to kill the encircled bacteria and digest it, and of course destroy it. So I just toss that up there. So again, as I usually teach students, say, hey, the phagocytes are just like Pac-Man. So this is like the phagocytes, say like the macrophage, neutrophil, and these are just it can be bacteria, it can be viruses, it can just be some things that are foreign that's not supposed to be inside your inside of your body, and your body will try to do its best to take care of business. All right, so what's interesting is this. I mentioned this before in terms of leukemia. Here's normal. The red blood cells to white blood cells. Again, of course, this does not look like the 700-to-1 ratio, but this is just to show what's going on. So say this is like pretty much just a normal field of red blood cell to white blood cell distribution. You have some platelets here, okay? But if you have leukemia, again, leukemia is cancer of white blood cells. So one thing with cancer, you just start making and multiplying a whole bunch of cells, okay? So that's what's happening. Here in this field, you see 4 white blood cells. Here you see a bunch of white blood cells, or in other words, leukocytes. So that's one thing that your body wants to actually maintain. It wants to maintain homeostasis. You don't want too little, rather you don't want too few number of white blood cells, but you don't want too many. You want a nice balance. But unfortunately, people who deal with leukemia, they have an elevated white blood cell count. Now, of course, in an infection with us, we will have an elevated white blood cell count. That is normal for a particular infection that our body is dealing with. But usually after the infection, after the white blood cells have actually eradicated the threat, then usually the white blood cell count returns back to normal. Whereas, unfortunately, with leukemia patient, the white blood cell count remains elevated. Here's another thing, okay? These are the white blood cells. And you might say, like, well, wait a minute, Brian, they're purple. Well, you have to use stains, particular type of stains, so that you'll be able to see the white blood cell. If these stains that are purple in color were not actually used, of course, you would not be able to see these cells. And I mentioned in another slide that you have a larger buffy coat. This is the white blood cell area. Here it's very thin in terms of the representation of the white blood cell or the presence of white blood cells, but here you have a larger buffy coat. And that is one particular sign that, okay, you can have a leukemia patient. Now, again, like I said, could this happen to maybe you and I, maybe during an infection or following an infection? Yes, our white blood cell count will increase. I don't know if it will increase to this level, having this large of a buffy coat, but yeah, you will have some increase there. And then the platelets, or in other words, the thrombocytes, are serves in blood clotting. Okay, so basically you have a cut, you bleed, the thrombocytes, their job is to, again, these are your erythrocytes, the red blood cells. The thrombocytes, their job is to go to the area, okay, where that there's leaking, damage, all right, and they'll use a bunch of different types of factors, like factors, say 8 and 9, and other proteins to actually plug, okay, that hole, that cut, and start actually developing a fibrin or fibrinogen clot to start clotting it using the clotting factors so that you're not bleeding out. Okay, because we want to keep the blood inside the circulatory system. So the platelets a very important role in terms of blood clotting. Sorry, folks, that's my phone. All right, and again, yet again, the blood cells or the platelets actually playing a role in plugging up a hole so that we're not bleeding out. And for medical purposes, there are some things like heparins. So you have here, you have heparin, streptokinase, aspirin, and warfarin. These are things that actually are used to thin out the blood. There are some cases where that you have people who have problems with blood clotting. Basically, you have blood clotting, anything that can lead to a heart attack, stroke, what have you. So sometimes healthcare professionals will administer streptokinase, warfarin, heparin in order to, in a sense, kind of thin out the blood. Aspirin, sometimes there are some people who take aspirin daily just to keep their blood a little bit thinner than normal. So it's just up to the healthcare professional. I will have a story. I do have a story. I remember this one time. This happened years ago, and gosh, I was blowing my nose a lot because I think I had like a cold or a flu, and I was just blowing my nose for like a good day or two, like a trumpet. Okay, and then I was taking medication. Can't really exactly remember what medication I was taking. I was taking medication. To treat the symptoms of the cold and the flu. And then in the middle of the night, my nose started bleeding. And I mean, I used to get a lot of nosebleeds when I was little, when I was growing up there. So, I mean, it was no big deal. However, so I did the procedures to decrease the likelihood of, rather, I did the procedures that I've always known to do to help prevent or to stop the nosebleed. Well, for crying out loud, it was not stopping. And I was like, man, what is going on? And it just was not stopping. I was pinching the bridge of my nose. I was telling you, you just should pinch the bridge of your nose real tight and push up against the bone. And it just was not stopping. And I knew immediately the cause. And I said to myself, I bet you the medication that I took has aspirin in it. And because aspirin serves as a blood thinner, and it's going to decrease blood clotting. And I went to the medicine shelf, pulled it out, looked at the active ingredients, and for crying out loud, it had aspirin in it. And I knew, I was like, oh gosh, okay, this is going to be, this nose bleeding process is going to take a little while longer than it should. Eventually, of course, it stopped, but yeah, so that's one thing about aspirin. I mean, it has its good in terms of being a pain reliever and thinning out the blood a little bit or anything for patients who have, heart issues, heart conditions. But in that case, in the case that I was dealing with, it really wasn't my friend. But like I said, fortunately, it stopped. All right. Thank you.